Hi, Nathan Stickney here at Foot and Ankle Associates of North Texas. I'm going to talk to you about a condition called Hallux limitus, or what we call when a bunion is not a bunion. What Hallux limitus is it is a painful big toe joint. What happens is you have a limited motion of the big toe joint. By this limited motion, this causes a lot of pain in the area and it can cause arthritis of this joint. It is commonly thought of as a bunion. These are two separate issues. Hallux rigidis or hallux limitus is actually just a limited motion that causes the arthritis instead of an actual deformity of the first metatarsal and the big toe. What we do with hallux rigidis is when the patient will come in, we will take an x-ray. Generally, we can diagnose the condition off of the x-ray. The x-ray will show us the joint, and if it does have bad arthritis, if it has bone spurs or any kind of changes to the joint like that. If we need, we can always order an MRI or CT scan to better evaluate the joint. Symptoms you will see pain and swelling in this big toe joint. Anytime you try to push off or flex the big toe joint, it can be very painful. Also, very commonly we see bone spurring around the joint. This can make physical exercise or any kind of activity very painful. Obviously, anytime you try to push off with that big toe joint, it's very painful. The bone spurs on the top can be very hard to fit in shoes, and unfortunately, that can rub and cause some pain. The treatment options that we do for this hallux rigidis is number one, a custom orthotic. We can add modifications to a custom orthotic that helps offload and support this joint. And by help offloading the joint, it reduces the inflammation and the pain. Icing and taking an anti-inflammatory is very effective. Also, very effective are steroid shots directly into the joint. By doing a steroid shot directly into the joint, we reduce the inflammation to that joint. If none of this conservative therapy works, then surgical therapy or surgical treatment is an option. There are three main treatments for this. Number one is going in and cleaning up the joint, basically taking all the bone spurs out and making it where the joint has a little bit better motion. We can generally do this in the early stages of hallux rigidis. When it comes to more mid and late stage hallux rigidis, then options 2 and 3 are much more appropriate. Option 2 is putting a joint implant in. We would put a joint implant just like you would do for a knee replacement. This takes away all the damaged cartilage and makes it where you have a pain-free big toe joint. The final treatment would be a fusion of the joint. A fusion of the joint is very effective. Unfortunately, you do lose the motion of the big toe joint, but it completely eliminates the pain and the inflammation that you get in that big toe joint. So if you're having pain playing basketball or any kind of activity and your pain is in that big toe joint, give us a call at Foot and Ankle Associates of North Texas and we'll get you checked out.